HHA Practice Test 2026 Home Health Aide, Full Course Safe Meal Prep Storage Guide. Question 1. What is the safest internal temperature for cooked poultry? 145 F, 155 F, 165 F, 175 F. Poultry must reach an internal temperature of 165 F to ensure harmful bacteria like Salmonella are destroyed. Question 2. How should an HHA thaw frozen meat safely? On the kitchen counter. In the microwave on high. In the refrigerator. In a sink of warm water. Thawing in the refrigerator is the safest method as it keeps the food at a consistent, cold temperature. Question 3. To prevent cross-contamination, which should be used? The same cutting board for meat and veggies. Separate cutting boards for raw meat and produce. Wiping a knife with a dry cloth between uses. Washing hands only at the end of prep. Using separate boards prevents bacteria from raw meat from spreading to ready-to-eat foods. Question 4. What is the maximum time leftovers can safely sit at room temperature? 1 hour. 2 hours. 4 hours. 6 hours. Perishable food should not be left at room temperature for more than 2 hours, 1 hour if over 90 F. Question 5. Where should raw meat be stored in the refrigerator? On the top shelf. In the door. On the bottom shelf. With the vegetables. Raw meat should be on the bottom shelf to prevent juices from dripping onto other foods. Question 6. What is the danger zone temperature range for food bacteria growth? 32 F to 100 F, 40 F to 140 F, 50 F to 150 F, 60 F to 160 F. Bacteria grow rapidly between 40 F and 140 F. Question 7. How long can most leftovers be kept in the refrigerator? 1 to 2 days. 3 to 4 days. 1 week. 2 weeks. Most leftovers stay safe for 3 to 4 days in a refrigerator kept at 40 F or below. Question 8. What is the first step in meal preparation? Cutting vegetables. Preheating the oven. Washing hands. Setting the table. Proper hand hygiene is the essential first step to prevent contamination. Question 9. Which food is a common choking hazard for elderly clients? Mashed potatoes. Hot dogs cut into rounds. Applesauce. Yogurt. Round shapes like hot dog slices or grapes can easily block the airway. Question 10. What should an HHA do if they find an unlabeled container of food in the fridge? Smell it to see if it's good. Taste it to identify it. Discard it. Ask the client's neighbor. When in doubt, throw it out. Unlabeled food is a safety risk. Question 11. Which diet limits salt intake to manage high blood pressure? Clear liquid diet. Low sodium diet. High protein diet. Mechanical soft diet. Low sodium diets help reduce fluid retention and manage hypertension. Question 12. A client on a diabetic diet should avoid complex carbohydrates, high sugar snacks, leafy greens, lean proteins. Managing blood glucose requires limiting simple sugars and high glycemic foods. Question 13. What is a characteristic of a mechanical soft diet? Only clear liquids. Foods chopped or blended for easy chewing. No spices allowed. High fiber only. Mechanical soft diets are for clients with chewing or swallowing difficulties. Question 14. How should dishes be dried after washing? Wiped with a damp cloth. Air dried. Wiped with a used hand towel. Left in the sink. Air drying is more sanitary than using towels which may harbor bacteria. Question 15. What should the refrigerator temperature be set at? 30 F, 40 F or below? 50 F, 60 F. Refrigerators must be 40 F, 4C, or below to slow bacterial growth. Question 16. When reheating soup, it should reach what temperature? 120 F, 145 F, 165 F, 190 F. Reheated foods should reach 165 F to be safe for consumption. Question 17. Which is a sign that canned food is unsafe? The label is missing. The can is dusty. The can is bulging or dented at the seam. The expiration date is next month. Bulging or leaking cans can indicate botulism or other dangerous spoilage. Question 18. What should an HHA check before preparing a meal for a client? The client's favorite color. The care plan for dietary restrictions. The weather forecast. The TV schedule. The care plan outlines specific nutritional needs and restrictions. Question 19. Why is hand washing important after handling raw eggs? To prevent the spread of salmonella. To keep hands smelling fresh. To prevent egg stains. To cool the hands down. Raw eggs can carry salmonella, which causes food poisoning. Question 20. A low cholesterol diet typically limits fruits and vegetables, whole grains, saturated fats and fried foods, water intake. Limiting saturated fats helps manage heart health and cholesterol levels.